Let's look at the micturition reflex, also called urination or voiding. Urine will leave through an opening called the external urethral orifice. The reflex is controlled by two centers within the pons. We'll look at those centers in just a moment. In order for voiding or urination to occur, three things must happen. The detrusor muscle, or the muscle within the walls of the urinary bladder, must contract. The detrusor muscle is smooth muscle and is innervated by both branches of the autonomic nervous system. The parasympathetic branch, which causes it to contract, and the sympathetic branch, which causes it to relax, is inhibitory. The second thing that must happen is the internal urethral sphincter must relax and open. The internal urethral sphincter is smooth muscle, and it is also innervated by both the sympathetic and the parasympathetic. The parasympathetic input will cause the sphincter to open, whereas the sympathetic input will inhibit this and keep the sphincter closed. The third thing that must happen is that the external urethral sphincter must relax and open. The external urethral sphincter is skeletal muscle, and thus it is voluntary. It is innervated by the somatic nervous system. When the amount of urine in the urinary bladder, or prior to the amount in the urinary bladder, exceeds 400 mils, the stretch of the urinary bladder wall will trigger stretch receptors located within that wall. Stretch receptors then will send information by way of afferent pathways, both to higher brain centers as well as to the sacral region of the spinal cord. Information from the sacral region of the spinal cord by way of a reflex will increase parasympathetic and decrease sympathetic input into the detrusor muscle and the internal urethral sphincter. In response, the detrusor muscle will contract and the internal urethral sphincter will relax. Recall that in order for micturition to occur, the external urethral sphincter must also relax or open up. We're going to follow the pathway that is involved in controlling the external urethral sphincter. Let's follow the afferent pathway to the higher brain centers. The higher brain center is where you decide whether it is appropriate to urinate or not. It is also where you get the sensation of having a full bladder. The pons consist of a micturition center as well as a storage center. If it is appropriate for you to urinate, the pontine micturition center will fire. It will send information by way of efferent pathways to decrease somatic input into the skeletal muscle of the external urethral sphincter, allowing it to relax and open. In addition, it will decrease sympathetic and increase parasympathetic input into the detrusor in the internal urethral sphincter by way of autonomic fibers. When all three of these occur, the contraction of the detrusor muscle, the relaxation of the internal urethral sphincter, as well as the external urethral sphincter, micturition will occur. If, however, you determine that it is inappropriate for you to urinate, the storage center will be in control, and it will inhibit micturition. It inhibits micturition by way of decreasing parasympathetic and increasing sympathetic to the detrusor in the internal urethral sphincters. This will cause the detrusor muscle to remain relaxed and the internal urethral sphincter to remain contracted or closed. Increased somatic input into the external urethral sphincter will cause it to contract and remain closed as well.